My name is Patty. I'm 39 years old and I've been an insulin-dependent diabetic for 21 years. About 12 years ago I was diagnosed with diabetic retinopathy, which is when there's bleeding in the back of the eye. Left untreated, it can lead to blindness. There was an area in the back of my eye that they performed laser surgery on, which corrected the bleeding, but unfortunately left me with a minor permanent loss in vision. About 5 years ago, they discovered another area in the back of my eye that was bleeding. This time it was very close to the center of my eye, and they couldn't perform the laser surgery on it. If anything were to go wrong with the laser surgery, the risk of me being permanently blinded was too great for them to be able to take the chance. So instead, the ophthalmologist decided to keep watch on that section of my eye until the risk of going blind from the retinopathy exceeded the possible risk of going blind from the laser surgery, and then we would perform the laser surgery. Over the past 5 years, a few other minor areas have popped up with the retinopathy in that eye and also in my other eye. About a year ago, I also started having problems with my right leg and hip. I was having numbness and tingling in my leg and hip and went to my doctor, and he performed a series of tests, an MRI, a nerve study, suggested painkillers, physical therapy, exercise, and nothing relieved the symptoms. The best thing that he could do was to prescribe me painkillers to help alleviate the discomfort that I was having. And that's a very typical course of treatment for diabetics. There just isn't much that they can do. In June, I was complaining to a friend of mine that I was having trouble remembering little things in short-term memory, and it suggested to me to try a product that uses OPCs. And the OPCs are really powerful antioxidants, and she suggested that this may help with my memory problems. So I figured, well, what the heck, I'll give it a shot. After 3 days on the product, I noticed I woke up one morning and said to my husband, you know, my leg doesn't hurt anymore. And that was really odd because it had been hurting right along, and nothing made it better. I didn't really believe it was the OPCs, so I stopped taking them. And within a few days, the numbness and tingling was back, and there was actually a lot of pain came with it as well. So I started taking the OPCs again, and all the symptoms abated once again. I'm forever a skeptic. I still didn't believe it was the OPCs, so I stopped taking them, and again the pain and numbness came back. I started taking them again, and it went away, to the point that I'm completely convinced that is what made my symptoms disappear. In the process of doing the tests for the neuropathy, they had also discovered that I had a diminished reflex in my right knee, and I had no reflex in my right foot. In October, I went back to the doctors for a routine physical, and the reflex in my knee had returned to normal, and I did have a reflex in my right foot. It was slightly diminished, but it's there, which is a lot better than it was. And I thought, I wonder if that's from the OPCs. My doctor looked over the literature and determined that I should continue to take it. In November, I went back to my ophthalmologist, who found that he couldn't believe what he saw. He said, I don't know what you're doing, but whatever you're doing, keep doing it. The retinopathy in my eye, the area that was leaking, had stopped leaking. The fluid that had pooled there, which normally takes about a year to be reabsorbed, was almost completely reabsorbed. This was after being on the product for only 6 months. I had also been hesitant to go back to the ophthalmologist because I knew I wasn't seeing well, and in 12 years, every time I went, my prescription got stronger and my vision was getting worse, and I didn't want to have to get another pair of glasses. I was just tired of dealing with the whole thing. I was right, I wasn't seeing as well. When they did the eye test, it came back that my prescription was actually too strong. My vision had improved and is where it was 3 years ago. So not only did the OPC help the retinopathy, but it's also helped remove the fluid, which has made my vision much better. My latest development is I have the very beginning of kidney disease, which is again another complication of diabetes. I was put on a blood pressure medication that the side effect protects the kidneys from kidney disease. I have been able to discontinue the blood pressure medication and still maintain the health of my kidneys by using the OPCs. My doctor doesn't know what's going on. He can't really explain it, but says to continue taking it. And if you do anything, find out what this product can do for you, because instead of dying from diabetes, I'm now living with diabetes, thanks to the OPCs.
Hello, my name is Aaron, and I've been taking the OPCs for the past 3 years of my life, and it's dramatically changed everything that I've done in those 3 years. I played water polo for the past 8 years at college and in high school, and now I play professionally in Australia. The OPCs has dramatically changed everything I've done in the water and also out of the water in academics. It all started about 3 years ago, before my first 2 weeks are known as the hardest 2 weeks of practice. We start off with 3 hours in the water in the morning, 3 hours in the afternoon, followed by a 2-hour drylands running session and weights. This is very hard on our bodies. Our muscles are continually drained, and it's hard to recover in between practices. It just makes it for long days. When my father came up to me about these oligometric proanthocyanidins, also known as the OPCs, he told me a couple things. First, my muscle time would recover. Second, it would make me a better athlete, and it would also help my concentration time in the water, and it would make me a healthier person. At first, I was very skeptical, but because it was my father, I didn't want to disappoint him and make him mad at me, so I decided to make him happy and take the OPCs. After the first week of practice, I noticed some dramatic changes in my performance. I was swimming a lot faster times. My endurance times were a lot longer. I was recovering in between practices, and most importantly, my injuries in my shoulders had seemed to disappear. As a college athlete, we are often scrutinized over performance-enhancing drugs and other supplements that athletes are known to take. I was also very worried about this. But seeing OPCs are a completely natural substance, I cleared it through my athletic training staff, my coach, and had it checked out also with a physician. This is a completely natural substance, which gave me a lot of comfort as an athlete. In college, it's a lot of hard work, being an athlete and trying to balance school. There's more to college than just being a dumb jock, and I try to exemplify that as much as I can. Taking the OPCs has really helped me out in my academics as well as athletics. Getting up at 5 a.m., having 2 hours of practice, then running a 4-hour class, another 3-hour practice, sometimes weights, and then having to go back, do a research paper, study for midterms, finals, and then have a job at night to try and pay for it all is very challenging for a young adult who's very influential in his life. But the OPCs has really helped me out. It's helped me to focus in class when I was very mentally and physically tired. It's helped me focus out of class studying for class and research. And more importantly, it's helped me to become where I am today. My last year, I accomplished Dean's List and Student Athlete of the Year, as long as All-American honors in water polo and first team All-League. Over the past 3 years, the OPCs has made me a better person because it's given me the energy to do the things I want to do in my life. The things that I've wanted to do was be the best person I can, be the healthiest person I can, and make everyone have energy around me. As an athlete, I pride myself in having lots of energy and being in good shape year-round. And being in good shape year-round means having my body perform at the top level and being able to recover. This all-natural substance isn't performance-enhancing. It helps my body maintain its refreshness and its muscle endurance. And it helps my inflammation and my tendons go down so I don't have problems with tendinitis anymore, and I don't have to sit out games or sit out practices, which in the long run makes me a better player. And again, the OPCs has made me a better person, a better player, and a better student.
Hi, my name is Mario, and I started taking OPCs about 5 years ago. I started taking them because I was told that it would lower my cholesterol. Well, at last check, my cholesterol has been lowered by over 150 points. This, and for that reason only, I would stay on OPCs for the rest of my life. But something else happened that changed my life. I had hip pain for 20 years, and I had been to different chiropractors, doctors, and surgeons, and they all told me that I needed a hip replacement. In 1994, I was told that I needed the hip replacement now. Not wanting to go through that operation because that would just be the first of them. There would be many more probable operations right after that. I I decided to try and live with the pain as long as I possibly could and lived on over-the-counter painkillers. After being on the OPCs for about two weeks, I woke up one morning pain-free. Now, I didn't believe it was the OPCs, so I went off of OPCs, and the pain came back. So I went back on OPCs, and the pain went away. Still not believing, I went off of OPCs again, pain came back. Back on OPCs now, and I've been pain-free, and I'm doing everything I couldn't do before, such as ride my horses, skiing, racquetball, playing baseball with my son. I thank OPCs for this.
Hi, my name is Lori, and I'd like to tell you where my life was about 2 years ago. I'm in my mid-30s, and I had lifetime allergies, especially to cats, which developed to seasonal allergies and then to asthma. I couldn't walk around without my inhaler. I also have muscular dystrophy. The type I have is myotonic dystrophy, and I also had a lot of back problems. The two together made basically any kind of movement very difficult, if not impossible. I also have 3 valves in my heart that are prolapsed, and without the exercise, because of my back, I was having a lot of irregular heartbeats and a lot of chest pains. I also had a condition for 2 years with my lymph nodes. One day they were just swollen, and I had to go through different medications, many biopsies, even removal of the lymph nodes because they were swollen, and the doctors just said it was nonspecific inflammation, and they thought that it was a pre-Hodgkin's condition. I began taking OPCs because I was hoping for some relief for my back problems. Within 4 to 5 minutes of taking my first dose of OPCs, I noticed an immediate surge of energy, and I thought, wow, this is pretty neat. Within 1 week, my asthma and allergies were completely gone. I have not used an inhaler. I do not own one. I could even sit with a cat on my lap for 2 hours without sneezing. My myotonic dystrophy and my back problems have basically gone away to where I can do whatever sports I want without taking muscle relaxers or pain medications. My heart is beating much better now. I don't have the so much irregularities. And my lymph nodes, I'm proud to say, within 2 to 3 weeks of taking the OPCs, my lymph nodes returned to normal size, which is something that the doctors were not able to do for 2 years.